So just kind of going over where we are with our budget for this year and then where we're at for next year. So in June, on our first meeting, we'll bring forward a preliminary budget for you guys to look at, and then we'll approve it on the 16th. Right now for this year, our enrollment is up slightly, you can see, from what we originally anticipated. For next year, we need more kindergartners. So if there's anyone out there with a kindergartner that needs to come to school, sign up. Especially up in Big Fork, that enrollment is really low right now. But any kids we're welcoming here. Enrollment is up, I should say that. But when you're graduating over 300 kids and you have less than 300 coming in, you do the math, it's not working out. For our COVID grants, we have 16. We actually have 17. We were just awarded another COVID grant. It's an MTSS grant, multi-tier systems grant. Kudos to Jen Sodine for writing up the grant. She did an awesome job. It's for 2 years and strictly for MTSS. At this point, as of yesterday, we had $7 million left to spend in COVID funds, and of that $7 million, $5 million can be spent on insurance, on operating items such as salaries. The rest can only be spent for special initiatives like our clinic or special ed or homeless grants. And excuse me, and summer school. The majority is for summer school and after school programs. You can see our original budget, we approved a $2 million deficit. With my updates, we're still at an approximate $2 million deficit for this year. That's not going overboard with any of our COVID money. That's about $3 million this year in COVID money that we will use for our operations. Part of the reason our expenses and our revenues went up by the same amount has to do with the amount of COVID money we got. We got so much for summer school and after school money. So we don't get it if we don't spend it. So we need to spend it to get it. So those offset each other. Our insurance, again, like I've talked about so many times, was significantly higher than we thought. Our state aids were 2.45. That was $650,000 more. That's not a lot of money. And at the end of this year, we are really recognizing the inflation in gas for our buses, for our utilities, our natural gas. Those are up 36% over the last 2 years, our utilities. So that is very significant. That's $1.5 million. Now, when we sell Murphy, that will get rid of some of the costs, but not enough to put a dent in this inflation. For next year, we are still planning to balance the budget. It just depends on how much COVID money we're going to have to use to do that. We have reduced staff at all levels. This is the third year of doing that, third or fourth year. We are losing one of our grants, our Support Our Students grants, which we have received for the last 5 years, and that has helped with our student support staff. We plan to increase activity fees for students and for adults that attend sporting events, and also the passes. We also plan to increase food service meals by 5 cents. And students haven't had to pay for the past 2 years, but as it sits now, they will have to go back to paying for school lunches. Next year, we will be paying about $2 million more just in health insurance. The district's a family premium next year will be over $30,000. So for every staff that is on a family premium, the district is going to have to pay $26,850, which is more than some people take home in salary. So that is a huge issue. We will be paying $5,300 more for every staff has family insurance.
Carrie, do we know how many staff that is? Do we know approximately how many staff receive the benefit?
333 did this year.
Okay.
And then the singles, we will also be recognizing an increase of 25% on them also. We have some unknowns out there. Our enrollment, like I said, inflation, the bonding bill, is that still out there, Matt? Sweet.
It is.
And we don't know if we're going to get any additional money from the state or federal government. We are reducing our capital purchases for next year, buses, and we're looking at ways to save on gas and be safer with the routes like we talked about at the work session. When we sell Murphy, we will reduce our utility costs, so that will be good. And then we're unsure how much of our COVID money we'll have to use next year to balance the budget.